Wanju, Ngara, Jurp Wang and Yunuk. My name is Richard Wally. I'm a Nyungar from the southwest of Western Australia with strong Yamaji connections.
My name is Christine Parry. I'm the Aboriginal Health Officer at Armidale in a program called Budjari Yogas. And Budjari in Noongar language means pregnant, and Yogas means women and girls or girls. So it's a maternity program that's been at the hospital since 2007.
My name is Bernie Ryder from the Pilbara. I became a healer around about 1981, so from there I've just had to learn how to develop, and I've had a couple of the old people teach me how to do it. And then now they're all gone, now I have to start working with others. So it's a learning process, very hard, but you find that when you do it, it means a heck of a lot more to everybody else and to you.
So my name is Leah Bonson and I'm Director for Aboriginal Health for Child and Adolescent Health Service with the Department of Health.
Aboriginal healthcare system is important to have things that are familiar to them that surround the place, whether it's people, whether it's objects. That's important, and I think being familiar makes people more relaxed.
To build the relationship with Aboriginal people, like in the health system, to get to know them, to find out what their needs are and their concerns, to always acknowledge them as the traditional owners in the areas that you work with, but then also just to build a relationship and just finding out, like I said, their concerns when coming into the health system. Like with our program, for instance, we work with a lot of young Aboriginal mums and their families, extended families. So we're finding out what their needs are in the community. When it comes to maternity care, what are they actually looking for in the health system when we're working with the midwives? So if there's any concerns, we can actually deal with that and work out what's the best way to approach things.
Annie Young, WA Primary Health Alliance. So a good patient experience for an Aboriginal person is important as they set the foundation for future care. When an Aboriginal person, as anyone, receives a good experience when they're in a health setting, it sets them up and encourages them to continue to access healthcare as they age.
If they've got something there that they are familiar with and they don't have a fear, then they're going to accept it and work with it.
Working at a children's hospital, we get mums and babies and young children coming there, and we're getting people from regional and remote areas who may not have experienced the city at all, let alone a tertiary hospital like Perth Children's Hospital. So we try to make it as culturally friendly as possible. That's ensuring our staff respect our Aboriginal families there, understanding their culture, and sometimes English is not always the first language, so it's how we communicate with them.
Patient experience is extremely important because the healthcare is all about patients. It's about the person. And if you understand a little bit more about what the person does or where the person's from or what the person stands for, that helps a lot because it's their experience that you're dealing with.
It makes it easier for doctors and for medical staff, but also it helps the patient in healing. And once they've got that, then they can, they won't have a fear about coming back again.
I think it's really important, not just in the community, but right across the health system. And it doesn't matter which health system you're actually involved with. Just building that relationship, just finding out and getting the patients to understand what the health systems, their policies, going into the emergencies, for instance, just working with doctors and nurses, what their concerns are, explaining things properly to them, not talking above them, so that they're not afraid to go into hospitals if so.
I hope that there's a smooth transition so that Aboriginal people feel comfortable about approaching, engaging and participating in health practices.
Where they don't feel isolated, where they're not feeling that they can't trust anybody, so just to come back again and building that trust, which is a big thing, and communication as well, where they can actually come in there and feel that they're welcome in there and not judged.
It's important that Aboriginal people access health care earlier on so that if there is a chronic disease or if there is an issue with the health, that we can catch it early and that we can make sure they get the care they need in a timely way. Culturally safe care is vital. Culturally appropriate care in a healthcare setting is key to making sure that we can close the gap in Aboriginal health.
My hope is that we have a greater say in our health, in Aboriginal health. It's gone from a system where we weren't treated right, we weren't treated equal, but now it's in the system where we have got people who are trained, they're doctors, they're nurses, and in the future what I'd like to see is more involvement and it's making it better for everybody else.